Hello and welcome to my channel. This is a case of a proliferative diabetic retinopathy, younger patient who has had a tractional retinal detachment which is gradually closing in on the macula. As you see here, the entire superior quadrants are detached. I've started out with doing a peripheral vitrectomy in order to start the dissection. Thereafter I've used a pick in order to induce a PVD from the posterior pole from the disc. This is a very good maneuver in case one wants to start from the in and out maneuver. And so here I've pushed it slightly too far in this very ischemic retina. There's a very small hole there, so I convert to bimanual technique using forceps and scissors. And so I'm slowly dissecting and delaminating those fibrovascular membranes, which are extremely adherent to the very ischemic retina. And there are multiple pegs between those fibrovascular membranes and the retina, which need to be cut off. The patient does bleed very easily, despite having been given anti-VEGF therapy just days prior to the surgery. And so generally I try to be slightly cautious with diathermy use. I don't want to be too uh, keen on using it early on unless I definitely need to. However, after some time, it's just not possible because the retina is not that visible enough, is not visible enough to work on. Temporarily, temporarily raising the IOP will also work very well as a hemostatic technique. So most of those membranes are gone. That blood becomes a very adherent membrane onto the retina, and so one needs to dissect it as well. It's not just you can't just aspirate it from the retina. And so here I'm making use of a flute needle with a silicone tip, a soft tip, then doing some more peripheral vitrectomy, making sure there's as little anterior vitreous left as possible that the membranes can attach onto. I've injected triamcinolone to see if there's any vitroschisis. Try to aspirate some of that away. Unfortunately, there's a very small hole that does occur because the retina is so extremely ischemic. And there is a small membrane which I'm forced to remove because you cannot leave any membranes uh, anywhere close to retinal holes. And so convert to fluid air exchange and do some more laser and end the case with gas. Thanks so much for watching.